If you've ever suffered from anxiety, depression, trauma, or other painful issues, your first response may have been to hope that the feelings would go away. Or maybe you tried on your own to feel better, but it didn't work out. When that happens, you're faced with the prospect of asking for help, something that most people want to avoid. If you're thinking about seeking therapy for the first time, but aren't sure if it works, stick around for the answer. It might surprise you. Now is always the time to start making positive changes in your life. Dr. Donna Leigh Bliss here. On this channel, I promote optimal mental health and well-being to help you become the best version of yourself. So why do people seek help? Frequently, people have issues with anxiety, depression, low self-esteem, problems with their life that they're not able to fix on their own, and so they start thinking about maybe getting help from a therapist. Most of the time, people have to try on their own to solve problems, and when that doesn't work out and the status quo is so untenable and you're so uncomfortable, you might then be willing to seek help from a therapist, but you really might not be sure if therapy is going to work for you. When I work with clients, I always ask them if they've sought therapy before, and a good number of my clients haven't, and they usually talk about that they didn't want to seek therapy. This is the last place they want to be. And I think one of the reasons why people have such mixed feelings about therapy is based on how therapists are portrayed in the movies and on television. Frequently, therapists are seen as being inept, overly familiar, having romantic relationships with their clients. And so I think when people get this image of what a therapist is supposed to do, they think of those images, which are really not accurate at all. Or you may have been in therapy before and you didn't have a good fit. And so now you've made a judgment that therapy is not going to work for you. And really the issue isn't necessarily therapy, it's that maybe you just need a therapist whose style is a little bit better suited to you. Or you may have talked to other people that talk about how terrible their therapist was. And that may cloud your thinking about seeking help on your own. I've had clients tell me about that before, and I ask them, was the therapist terrible or did you not really work at therapy? And usually it's they haven't worked at therapy. I compare it to having a personal trainer, but you don't work out at the gym, and then you complain that the personal trainer's no good when you didn't do the work. But still, people can have very mistaken notions of what they think therapy is, and that can make it very difficult for them to take the first step in asking for help. So what does the research on the effectiveness of therapy actually show? If you do a Google search, you'll find that there are hundreds of different therapeutic approaches, and they all focus on different aspects of human functioning: how we think, how we feel, how we deal with childhood trauma, what our social relationships are like. So there isn't one right way to do therapy, it's just they offer different perspectives. So even though there's quite a bit of research on various therapies such as cognitive behavioral therapy that show that they're effective, there's very little research that compares one therapy style to another. And so the bottom line is that the research on the effectiveness of therapy has shown that there isn't one type of therapy that is better than others. And what's most interesting in terms of is therapy effective, the answer is yes, but it's not for the reasons that most people think. In my over 30 years of clinical experience as a social worker, I've worked with all these issues. I've worked with many different kinds of clients. And I've learned over time that the most effective aspect of therapy is the therapeutic relationship. It isn't so much the therapeutic style or the particular approach that I might use. It's that I've developed a relationship with clients where they feel cared about, where they don't feel that they're being judged, where they are experiencing empathy and encouragement. And so research has shown that the active ingredient in therapy is that it's the relationship, a caring, supportive relationship with a therapist. And that can make a huge difference in how people feel better and start functioning better. Back when I was a university professor, I taught a class on clinical practice with addictive disorders, and I talked to students, many of whom wanted to become therapists, what is sort of the secret to being a good therapist? And I said it's the 2 C's. If you really want to help people, you have to be competent. You have to know what you're doing. And that's actually pretty important. You can care about people, but if you don't know what you're doing, they're not going to be confident in you and you can't help them. And the second C is you have to care about them. And that caring has to be sincere. That doesn't necessarily mean that you agree with the person or that you found their behaviors acceptable, but you have to be able to rise above judging other people as people and not see them as a bad person and really genuinely care about them. And my experience has been when the 2 C's, the competence and the caring, are in play, that you can work with virtually anybody. And I've been privileged to work with many, many people over the years where I've been able to make connections with them following those 2 C's, which is really focused on establishing a healthy, supportive therapeutic relationship. And once I do that, then we can start working using various therapeutic approaches like psychodynamic therapy or cognitive behavioral therapy or transpersonal therapy that can help people learn new ways of coping and being in the world. And I have found over and over and over again that as long as I am emphasizing that caring relationship and I'm staying up to date with good therapeutic approaches, what the new research is, then there really aren't that many limitations of what therapy can do. So the answer to the question, if therapy is effective, is absolutely yes. The good news for you, if you're thinking about seeking therapy, it doesn't really matter as much as what approach the therapist uses. It really matters much more about the relationship they build with you. So I encourage clients to talk to therapists about their therapeutic style. How do they handle issues? And you actually get a very good sense of a therapist and how warm and accepting they are just by talking with them. And I found that when you feel that there's a really good connection, a human connection with somebody that cares about you and supports you and knows what they're doing, then you can feel confident that you can get better. So I hope that you consider that when you seek therapy, because I think you'll find no matter what your issues are, that therapy does work and you don't have to struggle with the feelings you've been having. So please get help today. I think you'll be really, really happy that you did. Thank you for watching this video. I hope you found it helpful. Please click on the subscribe button so you'll be notified when I release new videos that promote optimal mental health and well-being. I've included links to other videos you might find helpful, including one on how to choose the right therapist for you. Please check it out. I think you'll find it really, really helpful. If there are other topics you would like me to make videos on, please write them in the comments section below. And finally, remember, now is always the time to start making positive changes in your life. I'll see you next time.